Hey Future Medics, Tina here, your medic mentor, and today we're diving into one of the heavy hitters in shock management, norepinephrine. Brand name, Levophed. Now this is actually an old medication that fell out of favor, but with further research has come back into use because if we use it correctly, it's actually really great. Let's dive in. Norepi is a potent vasopressor. It works on alpha-1 receptors to cause vasoconstriction and increase blood pressure. It does have some beta-1, that heart, effects which cause increased contractility, but not as much as we saw with dopamine and epinephrine. Mostly, this one focuses on increasing blood pressure and works amazing in our septic patients. In EMS, we'll use Norepi for patients who don't really respond to fluid resuscitation and remain extremely hypotensive and usually altered. This, though, does not replace fluid resuscitation because it's not. It's a chemical clamp to try and get that blood pressure up. This still needs to be given after a fluid replacement, so lactated ringers or normal saline, and continue to give those fluids while you are administering Norepi so that it has something to squeeze in on to do its job. Now, this one is going to be a continuous infusion, so you're going to give it IV and IO, and it needs to be on an IV pump. It onsets within 1 to 2 minutes, really fast. And its duration, it stops within 1 to 2 minutes. So as soon as you start this, you'll see their blood pressure increasing. And as soon as you turn it off, it'll start to decrease. So keep a really close eye on your patient. The other really important thing to know about this one too is if your line, your IV that you have is not patent, this will also cause tissue necrosis. For that reason, the hospital likes to have a central line. We, of course, can't do that. The ambulance is not sterile by any means. So keep a very close eye on your IV. Make sure things are flowing well and it's not bubbling up at the site, and it is indeed patent. Side effects you're going to want to watch for are hypertension, arrhythmias, and peripheral ischemia. Think fingers and toes. Now for contraindications, we're going to avoid this if we have not given them fluid resuscitation first. We have to start with those fluids, and then it can come and do its job. But a big one to avoid is patients with mesenteric or peripheral vascular disease, because this is going to cause a constriction of those vessels, and it could clamp off circulation to those areas that are already having problems with circulation. Here's your takeaway. Norepi is often the first line for our septic shock patients and our hypotensive patients, but you do have to give fluids first, okay? It requires very close monitoring of your patient, taking those blood pressures much more often. But that's it. That's another medication knocked out. You're doing such a good job. I'll see you for the next one.